Welcome back. This is Dr. Jin Sung. Today is Tuesday at 12:30, and today we're going to talk about fibromyalgia. So, I'm going to do a three-part series on fibromyalgia alone, okay? So I'm going to talk a little bit and give you a little synopsis of what fibromyalgia is, and then over the next 3 weeks, I'm going to give you some detailed information on how to find the right doctor, how to find the right nutrients, how to find the right pathogens, how to find the right quote-unquote cure for fibromyalgia, right? So what is fibromyalgia? It's a really tough question, right? What is fibromyalgia? You don't know the answer, I don't know the answer, and most doctors don't know the answer. Because really, fibromyalgia is a garbage basket term for a multitude of symptoms. It's just, they don't know the exact cause, and they call it fibromyalgia because you have a lot of pain, right? Even if you go to like the Mayo Clinic website, they're going to tell you that most doctors don't understand what it is and what causes it, right? So let's look at it. If you look at fibromyalgia, right, the diagnosis, they just generalize it as widespread pain, fatigue, cognitive issues or brain fog, right? And then sometimes IBS can be associated with it, migraines, or TMJ problems or temporal mandibular joint dysfunction, interstitial cystitis or urinary bladder issues, right? And then the cause, they say, is maybe genetics, possibly an infection, or a physical or emotional trauma, okay? Yet the treatment in the medical model for fibromyalgia are just pain meds, anti-inflammatories, depression medications, or sometimes anti-seizure medications, right? Basically, you have a symptom, they got a drug. You got another symptom, give you another drug. I'm depressed because of all the pain, here's another drug. All they're doing is masking the symptoms. They never ask, why do we have such widespread pain? Why do we have the fatigue? And why do we have the cognitive decline? Right? They even say on their website, genetics. Well, what genetic, SNP is going to tell you that you have fibromyalgia? Right? They say maybe an infection, but they never look for infection, do they? Or they say physical emotional trauma. They don't know. They don't know the answers. And then over the next 3 weeks, I'm going to go over how we take care of fibromyalgia, quote-unquote, patient in our office. Because you have to get to the root cause, right? I'll give you an example. I have a young lady that came in, and she has widespread pain, cognitive decline, can't get out of bed. She works out a little bit, and then she's in bed, right? Everything hurts. So she goes from her primary to a neurologist. Neurologist runs a bunch of tests and comes back and goes, hey, I think we have fibromyalgia. Based on what? Right? They did an MRI scan, they did EMGs, NCVs, they did all this tests, and they come up, and because they find nothing, they say, you have fibromyalgia. Oh, try this medication. It should help you. Right? You seem a little depressed. Maybe you go to a psychiatrist. Here's another med for your depression. Right? Your tender points. So another way you can diagnose so-called fibromyalgia is there are 18 points in your body. You can look it up, Google it, right? 18 points or 18 tender points for fibromyalgia, right? If you have 11 of the 18 points that are tender, then you are considered to have fibromyalgia. But they never say why. Why do we have these tender points? We have to get to the root cause in order to get you out of this pit called fibromyalgia. There is no solution in the medical model because it's all drugs, medications, that's it, right? Counseling. It's all in your head, right? What if I told you that one young lady had Lyme disease and they never went and checked, right? Widespread pain, fatigue, Fever, unknown origin, Lyme. So Lyme could be a cause. I'm telling you, fibromyalgia is a diagnosis easily thrown around when they do not understand what's going on. Okay? What I want you to do is like this page, like the video, and or follow us so you can get the updates over the next 3 weeks regarding fibromyalgia. We'll get you to the real root causes of why we have such widespread pain in our body, or cognitive decline and fatigue and so forth. All right? So my name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you next week of part 1 of fibromyalgia. Okay? Don't forget to like the page. We'll see you later.